Hey, it's Dr. Hoyle here with another front desk talk. This time it's on the consent that you sign when you agree to have a tooth removed or, say, an implant placed. Um, Extraction of a tooth is an irreversible process, and whether it's routine or difficult, it is a surgical procedure, and so in any surgery there are some risks. So we're going to talk a little bit about that. First of all, you can have swelling, or you can have bruising or discomfort in the surgery area. You can have stretching of the corners of your mouth. We've got some chapstick for that. You can use that, and we'll apply that liberally, or Vaseline. You could get a possible infection afterwards. You know, the mouth has a lot of oral bacteria that can cause infection. It can get underneath and into a socket where a tooth is removed. We'll talk about that when we come to what's called dry socket later. Well, here we go. Dry socket is chronic alveolitis. It comes as a result of a tooth being removed, a little blood clot forming in there properly, but then somewhere along the way that blood clot is raised either through smoking or sucking negative pressure. It allows our oral bacteria to get underneath there. So that's a possibility of having that. And a dry socket or chronic alveolitis like that begins about a few days after a tooth is removed. And it does usually require additional care, such in the form of a packing or an antibiotic, but usually if you leave it, it will also get well on its own. You could have damage to teeth nearby, especially if a tooth has a large filling or something like that. It's very easy to knock loose when you're removing the neighbor. You can have numbness or altered sensation in the lip after a procedure. Normally you regain your sensation in anywhere from 3 to 6 hours afterwards, but some people occasionally have prolonged numbness or tingling sensation which is uncomfortable. That can come about from nerve damage or from even damage during injection. That usually doesn't last too long, but it can occur. You can have trismus or a jaw opening limitation problem afterwards, and that's very rare as well. It's usually the muscles that get damaged or hurt during a procedure, but then that usually heals as well very easily. You get extra bleeding. That's an important one because you need to tell us if you're taking Plavix or aspirin or any other blood thinning medicine like Coumadin, even some of the newer ones. Even things like Motrin can affect clotting. So we need to know about that ahead of time. You can have bleeding for a number of hours afterwards. We normally give you a gauze for you to bite on, and even post-operative bleeding or bleeding afterwards can be helped by moistening a tea bag and squeezing the water out and biting on that. The tannic acid in that can help clot blood as well. Sharp ridges or bony splintering can come through at the surgical site after it's closed over. You just need to let us know that's normal. Well, it can happen. Let's put it that way. Happens more than you'd like to think, perhaps. You can occasionally get incomplete removal of fragments of the tooth, but you need to let us know. And fragments of a tooth, sometimes it's intentional. We leave the fragments in the sinus sometimes, or as part of other types of treatment. But normally you need to let us know. Very rarely, jaw fracturing occurs, and so it's very difficult to treat. We need to certainly know about that. Most of the procedures are routine, and serious complications are very rare. Those which do occur are most often minor and usually heal up on their own. So, you got any questions, give us a call, 919-929-7155. All right, talk to you later. Bye.